Good day, dear viewers. Hope you are keeping safe and well. The pandemic has brought about unprecedented human and humanitarian challenges that we are experiencing daily and deeply. Countries, communities, economies, and workplaces have been impacted differently, and we may not still fully appreciate the extent of this impact. Companies around the world have risen to the occasion, acting swiftly to safeguard employees and migrate to a new way of working that even the most extreme business continuity plans hadn't envisioned. This is also true for the CSR programs, for which there has never been a greater need than today. Over the past few months, CSR leaders have adapted their strategies. Let's learn how. Today's conversation is brought to you by the National CSR Network as part of our Healed with Hope at NCSR project, whereby we bring to you inspiring stories of how to look beyond the tough times we face today and how leaders have reimagined and redefined the strategies to keep the show going on. The National CSR Network is an initiative of the Strategic CSR Alliance comprising of industry professionals to assist companies in India to drive their CSR agenda with measurable impact and facilitate implementation of social and environmental development projects. Today, I have great pleasure in presenting Mr. Paresh Parasnis, head of Piramal Foundation, one of India's leading foundations committed to addressing social issues through high impact solutions, thought leadership, and partnerships. At Piramal Foundation, Mr. Paresh is responsible for the Piramal Group's philanthropic activities implemented through its initiatives, including Piramal Swasthya, Piramal Foundation for Education Leadership, and Piramal Sarvajal. Mr. Paresh joined Piramal Foundation in August 2012. He's also active on the board of trustees of Soshit Seva Sangh, providing education to underprivileged children in Bihar, and Collective Good Foundation, which aims to bring various stakeholders of the social sector on one platform and contribute to the overall development of the social sector. Prior to joining the foundation, Mr. Paresh served as Executive Director and COO with HDFC Standard Life Insurance Limited. Mr. Paresh, we are very pleased to have you with us today. Can you kindly share what your focus areas for CSR are and also why you have chosen them?
Sure. Thank you, Madan, for that gracious introduction. And it's a pleasure to be on this discussion today. At the Piramal Foundation, I think one of the leading foundations in the country, our focus really has gone beyond CSR. The foundation is a young foundation, has been in existence for now close to 12 years. But really started when the CSR law was not in place. And in that sense, both the Piramal family and the Piramal group have contributed or looked to contributing to social issues in three areas. The first one is how can we improve the quality of education for children who are in government schools, which is the work of the Piramal Foundation for Education Leadership. The second one has been around bringing affordable and accessible primary healthcare to parts of the country which don't have these services readily available, which is Piramal Swasthya. And the third one has been focused on bringing safe drinking water to, again, people who don't have access to safe drinking water. Piramal Sarvajal kind of fulfills that mandate. I would say in addition to that, Madan, there's also a program that we run with the youth, a fellowship program. It's again been around for about 12 years now. It's called the Gandhi Fellowship. It's in its 13th batch today. And in this program, we essentially welcome and encourage young students, graduates, or even youngsters who are in a job, to give 2 years of their life full time to be part of the fellowship. They are based in rural India and they work in the education system with the government education system. And the whole idea is not to really make only education experts from these fellows, but really help them understand what it means to bring about change in communities, bring about change in themselves, and in a manner that they can meaningfully contribute to building the future of the country. So it really traverses those four programs that I just kind of spoke about. As I also mentioned, it's a program that's kind of grown over a period of time. It today covers more than 20 states across the country. We are an operating foundation, which means I have team members on the ground in the remote parts of the country, right from Assam to Jammu and Kashmir to Karnataka in the south. More than 4,000 plus team members who are part of the foundation full time. And the whole idea has really been, how do you help governments improve quality and efficiency at the last mile? There are programs, there is funding that the government puts in. It's really quality and efficiency where we try and really support governments in delivering better quality services in the three areas that I spoke about.
Thank you very much, Mr. Paresh. In fact, I'll just like to drop on the large organization that you are, because you mentioned that you have about 4,000 full time who's working on the foundation. So what does it take to really manage such a large organization? Because you'll be obviously doing multiple projects, you'll be working a lot with partners. So could you share? How do you go about ensuring that the projects get completed, and how do you really provide leadership to such a large organization?
That's an interesting question because I think it brings out different facets of some of the work that we have tried to do. I think first and foremost, very clearly, entrepreneurship is extremely key to the kind of work we do. Entrepreneurship is important because when you are in a community setting, when you are engaging with governments, when you are coming across challenges and problems that are unique to each geography and each community, there cannot be a templated solution. You may have a core, which is uniform, that goes across every program or every project. But what needs to be done to make that better or needs to be done to make it effective is really, I think, the decision that the program leader has to take on the ground. And so entrepreneurship uh, kind of expects that there is a high level of trust that the leadership has in the front line. I think that's extremely important, number one. The second part, I think, that we've always focused on, and going to the point that you mentioned, I think delivering programs effectively and on time with the stated objective is extremely important. There's no question about it. I think at the same time, it's extremely important, we believe, to have what we internally call Seva Bhav, the spirit of service, and which is why all of us who are here today, my colleagues, have given up very senior level positions in the corporate sector, not because they had nowhere else to go, but because they believed that with their experience and with their skill sets, they could contribute in some form and manner. But while all that is happening, I think at the end of the day, like you were saying in a different context earlier, we have to understand that we are here purely as a medium to cause some change or to contribute to some change, I would say. And in that sense, the spirit of Seva Bhav and service becomes extremely crucial. And I think that is really at the core of the Piramal Group's value systems, which talks about knowledge, action, care, and impact. And care is really care for the stakeholders, for the communities, for the employees that I work with. So I think entrepreneurship and Seva Bhav are very crucial. And ultimately, I think as you look to building a large organization, how can we really adapt the best principles or best practices from the corporate sector or from leading organizations to build a corporation in a manner that can be institutionalized? I think that becomes crucial, right? Because it's not just that we can be here tomorrow, not to be seen 5 years later. I think we are trying to build organizations and what I would call institutions. So I think internationally, one would think of the Ford Foundation or the Rockefeller Foundation as institutions who have been around for a century, the Tata Trust, which has been around for a century. And for someone who's been around for a century and continues to contribute so meaningfully, it takes a lot of doing. Ultimately, it's people. Ultimately, it's people who make that happen. But how do you institutionalize what you're doing in a manner that this becomes person independent is extremely crucial. So I think a combination of entrepreneurship at the front line, everything that brings Seva Bhav to the fore, because we are at the end of the day serving communities who need that support, but in a framework which brings the best of global practices, corporate practices, professional practices, I think is what we are trying to really build together for.
And Mr. Paresh, I think you have beautifully summed that up. I think, and as I look at sustainable development, it's a lot about, the core values that you would like to, really imbibe, and at the same time ensure that, those values and the change that you try to implement sticks. So clearly you have been looking at it, from a complete perspective, not only the infrastructure and processes, but also the values. Now, given that we have had these, the last few months has not been very easy for the world, and for many of us, did you find yourself or the organization being tested on some of these values that that you espouse, which is the spirit of service and trust? And if so, how did you really go about ensuring that your organizations stay energized, stay motivated even during these tough times?
In fact, I would say that talk about the trust and the spirit of service, the spirit of Seva Bhav. Rather than those being tested, I would say those have really been strengths that we have drawn upon for two reasons. When we talk about trust, it's not just the trust of communities. So today, as a foundation, Madan, we've been working in what are called aspirational districts in the country, the most backward districts of India. We work in 25 of these across states like UP, Bihar, Assam, Madhya Pradesh. Uh, I think the trust that we have managed to build with communities and with the local administration, the district collector and his or her team, has been extremely valuable, right? Secondly, the fact that our team members come from a spirit of Seva Bhav, I would say those have actually been strengths because at a time when the whole world, as you said, has changed completely from what we have known it to be. When, as Bill Gates himself has said, 25 years of developmental work has been washed away in 25 weeks, I think it's been a huge challenge. And how does one really leverage this trust and this Seva Bhav in a manner that the organization brings in agility to meet the needs of the community was extremely important. So you're absolutely right. We were tested. We were tested because schools were closed. We were tested because the screening camps that our health workers would conduct were no longer permitted because of the situation. Now, how do you keep yourselves relevant and how do you still reach out to the community in a manner that you're meeting the needs of the community, not for your own good? I think agility in terms of how you're able to pivot and how you're able to reposition or repurpose yourselves was extremely important. So I'll give you a couple of examples to just kind of highlight how we have tried to do that. I'm saying tried because I think there are no perfect solutions in this world. So in education, we saw that schools were closed, kids were at home, and obviously we had a large field force which is out there in these districts. But we also saw that our relationship with the community was so strong. We said, is there some way we can leave education aside for the moment? Because it all started with relief work. I mean, we have seen that, we've witnessed that, we've been part of it. Relief was important, but over time, it has now moving to rehabilitation, is how I would kind of talk about the two phases, so to say, of this whole COVID situation. And frankly, I think our team kind of said that in these 25 districts, Madan, there are something like 3 million senior citizens. Now, these are locations which really don't have the best of services, the best of government facilities, and so on and so forth. And these are senior citizens, some of whom stay in a joint family, some of them who stay on their own, alone at times, and really struggle even to make basic ends meet. And we said, can we work through our team, put up an army of volunteers, work with local NGO partners and the district administration in supporting these senior citizens in three forms. One was to make them aware about what COVID appropriate behaviors are. So, social distancing, hand washing when you are in the public, and so on and so forth. Second was to support them for their daily requirements. So it could be ration from the PDS shop, it could be drawing pension from the bank, it could be for buying medicines, whatever it takes. And the third was, in case anyone was affected by coronavirus, to support them and for their treatment. So today, I'm so happy to say that through this whole mission that we started, it's actually called the Surakshit Dada Dadi Nana Nani Abhiyan, which was launched along with Niti Aayog. We are today working with 150,000 volunteers who come from the local youth, from the Nehru Yuvak Kendra, the local youth clubs, from the Panchayati Raj system. We are working with 100 non-profits, other non-profits, and of course with the district administration in supporting these. And today, I'm happy to say that out of these 3 million, we have managed to reach out to almost 50% of these senior citizens. And they at times just needed a voice to talk to. They just needed someone to kind of bounce off their compulsions or their concerns. So that was one thing that we did. The other thing on the health side has been that we run helplines for the government. We run what are called 104 helplines. So primary healthcare helplines, where a common man can call up and get his or her primary healthcare concerns addressed. It works with associates, it works with doctors, it works on use of algorithms and a clinical decision support system. And we saw that over the last 6 months, these 7 helplines that we run with state governments have handled more than 1 million COVID related calls. And that just meant that I need to know the nearest facility where I can get tested, or what are the symptoms I should watch out for, or I have these symptoms. Does that mean I have COVID? Is there a hospital I can go to? I need an ambulance. So anything and everything around COVID, 1 million calls is what our teams have really handled. Now, all this meant that we had to retrain our people. We had to repurpose ourselves as an organization and start positioning ourselves with our partners, which is really the government, the local government, and the state government, to say we are here to be part of your delivery mechanism. I think it's been a testing time, no doubt for everyone. But I think the two elements that you touched upon, service and trust and entrepreneurship, have really shown up as strengths rather than being tested at this point of time.
True. And I think it also like talks about the importance of core values and how it's important to work upon them when the going is good, because I mean for example, the spirit of service and entrepreneurship, because that's what can also tide you through tough times, as I think you have very beautifully shared. And what I also like reflected on is that your organization was even much larger, because you did speak about the full time, but then with this army of volunteers, you have been able to achieve so much. So I think I'm sure the country and even the citizens would be truly grateful for the kind of support that has been provided. So you would have definitely some inspirational stories that you may have come across about how the work that you do has impacted, and I'm sure there must be lots of such stories. But are there any personal stories that you come across that you would like to share with the viewers today?
I think I think there would be many, because especially at this time, as I said, people have really stretched to kind of make this work. A couple of thoughts that or stories that I would like to share. So recently, during the monsoon season in India, Assam typically witnesses floods. it would witness floods where villages are completely cut off for days on end, weeks on end. And there have been situations where our frontline health force, which is out in the field, actually supporting communities and supporting the ASHAs and the ANMs in doing COVID screening, surveillance work, and so on and so forth, couldn't access these villages. And so many stories where boys and girls have waited through floodwaters to reach a community just because it was their appointed day to be there or for the run. Survival, we run what are called water ATMs in the remote villages of the country, essentially provide safe drinking water to the local communities. And I remember about example in Rajasthan, where this individual, our frontline worker who was part of this initiative, ensured that not just the machine that dispenses water is sanitized at regular intervals, but he would go around ensuring that people maintained social distancing when they formed a queue to avail of water. They would clean their vessels very diligently before they came to fetch water. All that happened. And then over a period of time, he started working with the youngsters, the youth in that village, and actually went around the village to educate each and every household about what COVID was all about and what should they do to ensure that COVID didn't enter their families. Uh, Another example from telemedicine. We run telemedicine centers in remote parts of Himachal Pradesh, in the hilly areas of Himachal Pradesh. One of such telemedicine centers, this lady, an expecting mother, came for a checkup. She was in advanced stages of pregnancy in a place near Dalhousie, I remember. And the local officer, the telemedicine operator, noticed that something was not right. So immediately spoke to the specialist. We got her moved to a specialist facility immediately, delivered baby. The baby was premature and had to be taken care of in those initial few weeks. But today is 9 months old, hale and hearty. So I think such inspiring stories where people have gone, as you said, beyond the call of duty. No one expected them to do these things. No one asked them to do these things. But I think ultimately at the end of the day, Madan, those are stories and those are positive stories that really keeps all of us going. Because ultimately, I think that's possibly, it may be anecdotal, but I think that's a small proof that whatever we are attempting to do is bringing about some small change, maybe for an individual beneficiary, maybe for a family, maybe for a village, maybe for a community. I think that is what makes this entire process so worthwhile.
True, true, Mr. Paresh. And in fact, I recall reading an article, which spoke about a little acts of kindness during the times of COVID.
Mm.
And a lot of, and I fully agree. I mean, how much inspiring it has been because everyone, felt that, it's not just there. I mean, they're not living for I, me, myself, but it's more because there is a collective responsibility and we really need to do something beyond our own lives and it's not you don't have to do anything very big. I think even those little acts like the person wading through flood waters, etc. I think those are examples of how human endeavor and the human spirit can really
Absolutely.
thrive during these times as well. So thank you so much for sharing those
Yes.
beautiful stories. Now, as we like progress and as we try to grapple with the situation post COVID or whenever that happens, what would your advice be to organizations on how they run their CSR initiatives, or how do they really help continue the momentum that they have picked up and the learnings that they have had during these few months? So, would you like to throw a few words of guidance for the viewers?
Uh, so I wouldn't call it guidance or advice, Madan. I think these would be thoughts that I would love to share based on our
Sure.
experiences. Uh, I think two or three things stand out. One is at a time like this, and as you very rightly said, this is a time that we have never seen throughout our lives. I think the pandemic and what it has brought upon us. I think very clearly it is important to the element that we touched upon earlier, which was all around agility. How do we continue to be of service to communities? It may not be in a domain that I understand so very well, but how can I continue to be of service at a time when I may not have necessarily the skill sets? Some time back, a few months ago, I was listening to a senior in the space, Anurag Beher, who heads the Azim Premji Foundation. And someone asked him, saying, "What would you do about out of school children?" He said, "That is not my priority right now. My priority right now is how do I support communities who don't have food, who don't have a job, and who don't have access to healthcare. Education can wait. We will come back to that." So I think how do we bring in agility in both our thinking and our actions is extremely important. Number one. Second is, I think this kind of a pandemic has just proven the point, something that we have been talking about for quite a few years, that I think collectively what we can achieve is far more. I think it goes without saying that our individual resources, what each of us puts into the work that we do, is such a drop in the ocean that it will not lead to any, I would say, lasting impact or impact that will sustain if we decide to exit a particular community. And so I think there is increasing conversation today in the philanthropic and the CSR fraternity within India to say, how do we really build collaborations? How do we build alliances? How do we come together in a manner that, yes, our objective is the same, our routes possibly are different. What Madan may decide to do or the route that he might take could be different from mine. But ultimately, both of us are committed to ensuring that a child is learning well, that primary healthcare is available in the most remote locations. There might be different solutions we practice, but can we come together and rather than duplicating our efforts or rather than spending money where we could actually benefit from bringing it all, pool it together and bring it all together and replicate that in parts of the country where we are not present because we can't be across the country. So, how do we really build from what we have done together, collaboratively in an alliance, and then make that available to others in some other part of the country who are grappling with the same problem? And so, in that manner, replicate without having to learn from the brass tacks. So, I think collaboration and replication, to my mind, is extremely important. I think increasingly everyone's realizing that. I think the third thing, which would really be a sad thing if we waste it. I think this pandemic and all the work that we have done in the development sector has taught us a whole lot of things that work and a whole lot of things that don't work. And really, based on that learning, how can we help strengthen the government systems in a manner that change becomes sustainable? What you referred to, Madan, is extremely crucial. So, what we do with communities in alleviating their pain and their issues is important. Of course, no one denies that. But how do we learn from some of those practices? How do we extract principles from that practice that we can collaborate with governments to start developing their programs or their policies in a much more effective manner? Because unless there is systemic change, this will this issue will resurface 10 years later, long after we are all gone, right? And then the whole world will be learning again. But how do we learn from that? How do we help governments strengthen the system in a much more sustainable manner? So I think, to my mind, as I'm saying, agility, how do we collaborate and replicate? And thirdly, how do we help governments strengthen the systems of public delivery would be some thoughts that I would like to leave with the audience today.
And Mr. Paresh, that's an excellent way to sum up our conversation. I think it's always good to I always found that for you to really learn and to remember things, it's always good to talk of three things. And I think you you have captured those three things not only the start but also now. So thank you so much for that. Mr. Paresh, thank you for joining. And sharing the inspiring story behind the work that you have been doing in Piramal Foundation, both before and after during the pandemic. And thanks for sharing those inspiring stories. And I'm sure that that will stay with us for a long time. We'd like to wish you the very best in continuing your pioneering work and carrying the learnings, taking the collaborations forward to the next level. Dear viewers, thank you so much for joining us today. So, hope you found the conversation with Mr. Paresh inspiring and useful as you drive CSR initiatives for your organization and also be the change that you'd like to drive in the world. If you would like to share your feedback or suggestions or would like to know more about the National CSR Network, please do visit our website. You can also view our conversations with other CSR leaders in our YouTube channel. Please do share your comments and feedback. We would love to hear from you. In the meantime, thank you and stay safe and well.